Calling 911 in an emergency. It's one of the most basic government services you can imagine. But did you know the reason we all got access to 911 in the US wasn't actually government at all? The National Emergency Response System in the US was actually built by private philanthropy, using a repeatable blueprint for systems change. Hi, I'm Annalisa, and I spent nearly 20 years working inside government and philanthropy, and I learned firsthand how systems actually change. This story about 911 is going to show you one step-by-step system for how civic change actually happens in the US. And by the end, you'll see at least one path for how you can apply the system in your own community. To get there, let's rewind the clock to 1970. Imagine this. Your 6-year-old is outside riding his bike, and all of a sudden, you hear the screech of tires. You grab the phone, your hands shaking, and you try to call for help. There's only one problem. 911 hasn't reached your town yet. The number exists, but less than 1 in 10 Americans have access to it. Even in big cities like New York, a woman reporting a fire dials 0 for the operator and waits. By the time the line connects, her hallway is full of smoke and she might not make it out in time. In many rural communities, the local funeral home supplies your ambulance. No coordinated dispatch, no trained EMTs, no equipment. Just hop in and drive fast. This was emergency response in America for many, many decades. So how did we get from that to a world where we teach toddlers to call 911, where we grew up with TV shows about it, and we treat it like it's something that's just always been there? How did this huge transformation happen anyway? In 1966, a National Academy of Sciences report painted a stark picture. Combat medics in Vietnam were providing better emergency care than what was available to the average American. The report cited that half of all ambulance runs in America were handled by morticians simply because they had the vehicles. And the result? 107,000 Americans died from accidental injuries that year. 400,000 were permanently disabled. For anyone under 40, accidents were the #1 cause of death. Whether you survived an emergency or not depended entirely on your zip code. Now, AT&T designated 911 as the national emergency number in 1968, but it was just a number. The local infrastructure you needed to actually make it work, that didn't exist. So how do we go from that total lack of a system to the coordinated, expertly managed 911 system we all know today? Well, in 1972, enter the Robert Wood Johnson Foundation. RWJF was created upon the death of Robert Wood Johnson II, the longtime chair of Johnson & Johnson, the company his father had grown with products like baby powder and Band-Aids. And when he passed away, he left a huge portion of his wealth to form what was the second largest private foundation in the US at the time. The staff there scoured the country to figure out who was making inroads around the topic of emergency response. They locked in on the pioneering work of Dr. David Boyd, a Chicago surgeon who had created a proof-of-concept trauma system at Cook County Hospital by following military field hospital approaches. He proved that coordinated emergency response could dramatically reduce accidental deaths, and RWJF wanted to see if it could scale. So they designed a grant program to try and get other communities to replicate it. And to that end, in April 1973, the foundation announced a $50 million grant program. They made awards to 44 diverse applicants from fire departments to medical schools. And they did so in all kinds of communities, urban, rural, and suburban. And the grant money paid for all the stuff you'd need to build this out. Participating hospitals developed sophisticated communication systems that linked them to newly trained paramedics and ambulances. The ambulances themselves were redesigned and fitted with essential medical equipment so that patients could be evaluated and given acute treatment before arriving at the hospital. And protocols were put in place in emergency rooms so that teams could pounce on victims with the right targeted care as soon as they arrived. And the results were dramatic. Before the grants, only 11% of people in the targeted regions could call a single emergency number. But after the program ended in 1977, 95% of the populations in those regions could access emergency dispatch. Roughly a quarter of all Americans could now dial 911, a number that hadn't even existed a decade earlier. And in addition to proving the model could scale, RWJF built in that other key element professional foundation grant makers are always after: financial sustainability. They designed their grants as startup funding only, and they required that those local systems would become self-sustaining through telephone surcharges and state and local taxes. The foundation's success caught federal attention, and Congress then passed the Emergency Medical Services Systems Act, authorizing $185 million to expand the model nationwide. By the late 1970s, those grants wound down, but the system was self-sustaining. Now, that story might sound like a one-off success, but this is exactly how organized American philanthropy tends to operate. Take Andrew Carnegie, for example. Almost a century before 911, he used the same blueprint, funding thousands of public libraries, but only if local communities agreed to provide the land and commit the tax dollars to sustain them. But here's the part I really want you to take away. You don't have to be Andrew Carnegie or the heir to the Band-Aid fortune to use this same blueprint. You just need to understand how you can get involved and influence the flow of money that already exists in your community's civic ecosystem. And here's one way you can get involved in that, taken from my own experience. When wealthy donors pass away, they often leave behind large gifts to foundations or trusts. Those funds get invested, so the principal stays put, and the earnings can be used to make grants year after year, which means that the money can actually last forever. But it also means that somebody has to be there today and 100 years from now to decide exactly how to spend those dollars to meet the donor's wishes. And that's why foundations hire professional staff. And that's where my story comes in. I'm no Andrew Carnegie, but I ran the program department at a community foundation, and we used this exact same playbook. In addition to making grants in response to proposals submitted by nonprofits, we would work together with our board to proactively identify big community problems, test innovative approaches, measure the results, and then make the case so that government could scale the intervention. And that's exactly what happened with our infant mortality initiative in Lucas County, Ohio, which I want to be clear, I didn't invent, but I want you to hear about because it illustrates exactly how this blueprint works and how you can get an opportunity to use it. Now, this county had a big problem. In the early 2000s, public health data showed that African American babies were dying at more than triple the rate of white babies. 18 for every 1,000 births, as opposed to around 5. This was one of the worst racial disparities in infant mortality in the country. To put that in perspective, if you happened to be unlucky enough to be born Black in Lucas County, Ohio in 2001, your chances of surviving to the age of 1 were worse than if you were born in all of these countries in 2024. So the foundation put out a call for proposals for an agency to design an intervention to fix this deplorable state of affairs. The winning recipient, Hospital Council of Northwest Ohio, created a program that was brilliant. They went into the community in low-income census tracts and hired peers of the highest risk moms, and they trained those peers as community health workers. These workers met moms where they were and were given incentives for hitting key milestones, like getting that mom to prenatal appointments, connecting her to housing if she was homeless, or making sure there was a crib in the house before the baby arrived. The exact kinds of things that research tells us help prevent babies from dying when they shouldn't. And just like with 911, the results were dramatic. The incidence of infant mortality in participating families dropped from 18 to 8.7 by 2017. And you can't put a value on the price of those lives that were saved. But you can put a price on cost savings to the medical system. And this model reduced expensive Medicaid-funded NICU stays for premature babies by a lot. And there you see that key element in the philanthropy playbook. The foundation wasn't trying to run this program forever with its own money. It was trying to use its much smaller investment capability to build up the evidence base that this worked, so that Ohio Medicaid would pick it up and scale it. Because at the end of the day, it saved a lot of taxpayer money. And that's exactly what happened. I think this is fundamentally different from how a lot of people think about charity. Many people think philanthropy is just about writing checks to help people in need. But in my experience, philanthropists and foundations with professional staff and advisors think about their grants much more like venture capital for public policy, using private money to test what works so that public money can then implement a solution at scale. But here's what you're probably thinking. Great, if philanthropy can do all this and it has all this money, why doesn't it just solve all of our problems? Well, that answer comes down to basic math. Yes, the philanthropic sector in America is very large. There are over 2 million nonprofit organizations. The sector's spending is, by some estimates, $2 trillion per year. Americans donate nearly 2% of GDP to charity every year, much more than any other developed nation. But even with all that money, government still dwarfs philanthropy. Federal spending is approaching $7 trillion annually. Add in state and local budgets, and you're looking at this much in combined total annual spending. U.S. philanthropy, for all its impact, has a much smaller purse. And you've got to remember that $2 trillion number also includes things like churches, private foreign aid, many parts of the healthcare and education systems. So philanthropy can't replace government, but it does play a unique role in American public life. Alexis de Tocqueville noticed it back in the 1830s. Americans don't wait for the state. We form associations, churches, civic groups, charities, and that impulse never left us. Now, I don't tell this story because it's just interesting history. We're entering a period of big change. Federal money shifting, local and state governments under pressure, tough choices about where to spend, cut, and invest. And with these shifts underway, there's going to be a greater need for creativity and new thinking at your local city council, at the school board, your state capitol, or your local community foundation. Here's the key. You don't need to be a billionaire. You just need to understand how to influence the money that's already flowing, attract resources to your ideas, and find the inflection points for change. For example, I didn't come from wealth. I was a normal person who got a job at a community foundation. But that position let me direct millions towards solutions that worked. And as a community foundation, we actually helped many living donors, corporations, and local government agencies that had $5,000, $10,000, or $100,000 to stack their funds to create bigger leverage. To find the opportunities that are right for you, no matter where you sit right now, the first step is learning your civic ecosystem. Players, the institutions, how the money moves, what problems aren't getting solved, and why. If you're a donor, learn from this playbook and stack your resources with others to fund what actually works. If you're a student or early career professional, be entrepreneurial. Learn how nonprofits, social enterprises, grants, and foundations work. Understand where you can add value now. Pitch solutions and attract resources. If you work in government with any amount of budget authority, partner with Philanthropy to test smarter, more cost-effective approaches that can actually help you use your tax dollars more efficiently. If you want to be part of the solution, you need to understand the game. That's why I've created resources to help you navigate, like my Grants 101 guide and a live workshop I'm hosting where we are going to break down and work on real local community challenges together. The link to get on the waitlist for that is down below. I think it's important that more people get in the game of systems change, because at the end of the day, that 6-year-old on the bike, when he needs help, somebody answers. And systems like that are worth building, protecting, and improving. So hit like and subscribe, and I'll see you on the next video.